Great, thank you. Looks like stabilized here. Good morning, everybody. It's great to see you virtually. My name is Matt Mayhood. I am the president and CEO of the Silicon Valley organization, as the SVO. On behalf of the SVO staff, our board of directors, thank you for tuning in with us this morning. We're really grateful to have you here, and we're grateful for you and your business. We are busy as an organization advocating on your behalf, continuing to look for resources, tools, and information to keep you informed on all COVID-19 related matters. So be sure to check out our COVID-19 resource page on our website at thesvo.com. We're constantly updating that with new information and resources for you and your business. We're excited this morning to be partnering with the International Facility Management Association, or IFMA for short, this morning's virtual event. In just a bit, we're going to hear from a panel of real estate and facility experts on the impacts of COVID-19 has had on the workplace and how your facility can be ready and compliant for your employees and your customers after the shelter in place is lifted or as we prepare to go back to work. And we'd like to know who is on the call. So feel free to take a moment to, in the chat box, write your name and the name of your company in the chat box so we know who's with us this morning. And here to help kick off this morning's program is IFMA's Silicon Valley Chapter's President and SVO member, Christian Palikia of Slater Construction. Christian, I hope you're doing well. It's good to see you.
Good to see you too, Matt. Thank you. I am doing well, fortunately. For those of you who don't know me, my name is Christian Palikia, and I am currently serving as chair of the board for IFMA Silicon Valley. I've been a long-time member of both organizations, so I am especially excited that we are able to partner for this event, and I hope to partner for many more going forward. For those of you that are unfamiliar with IFMA, IFMA is an international organization with chapters all over the world. The Silicon Valley chapter of IFMA is one of the largest and most influential chapters, and we are the envy of all others, mostly because of our high-profile members such as Oracle, Roche, Google, Facebook, and the like. IFMA supports the facility management profession in many ways, particularly by providing educational and networking opportunities for our members, as well as workforce development programs. Now, I'd like to introduce our panel of experts. First, we have Mike Bangs. Mike is the Vice President of Real Estate and Facilities at Oracle. Currently, he is also serving as chair of SVO's Board of Directors. Mike is joined by Tracy Weimer, Vice President of Knoll, a design firm that produces office systems, seating, tables, and more for the home and workplace. And finally, moderating today's conversation is our very own IFMA board member, Katie Scott. Katie is also the Senior Director of Facilities and Site Services at Roche. Mike, Tracy, Katie, thank you for being here with us this morning. Matt, back to you.
Great, thanks Christian for introducing our panel. Just one last thing before we get started and take care of some housekeeping items. This meeting is being recorded and will be shared on our website later today. So by participating in this call, you're approving to being recorded. Also, to ensure that we have a productive dialogue on Zoom, all participants have been muted. And if you have questions as they come up, feel free to write them in the chat box. And during the Q&A portion, I will work with Katie to make sure we work those questions in if they are appropriate and germane and have not been answered. So let's jump on in. Katie, the floor is yours.
Thanks very much. So a fun fact for our audience today, many of you may not know that we've actually been planning a collaborative event with SVO and IFMA for many months. We were planning originally to have a mixer at Oracle in about a week before COVID happened. The topic for that was going to be best practices for bridging generational gaps in the workplace. And we've had to move away from that topic because we have this much more urgent and important one. But I'm really glad that we have been able to stay true to our intent to collaborate and really bring value to memberships of both of our organizations. So, I really love the topic of this discussion today. You know, we've all been kind of sheltering in place and, you know, anxiously awaiting the time that our community would be well enough and prepared to start to resume more normal operations. But many of us are really wondering, what will that normal look like? We know that it will be different. And I think from a strategic perspective, it's really important to really think about what way would it be different? And, you know, what should we be anticipating as things that we'll need to accommodate differently and consider differently as we start to open our doors and bring people back into the built environment? So I think it's wonderful that Tracy and Mike have agreed to be with us today. Tracy has been participating in some corporate real estate roundtables, so he has a really unique perspective on a lot of the conversations that are happening in different environments around the Bay Area. And you know, Mike is a leader in a global organization. Both of these gentlemen have access to colleagues in Asia and other parts of the world that are a little bit ahead of us on the curve. So I think we're going to have a really good, rich discussion, and I'm excited to see what we're going to learn. So our first kind of group of topics, I think, is really going to be focused on kind of procedures and policies. And I think I'll open it up with a question for Mike, and that'll be, what amenities do you imagine that we'll be providing in our office areas and company buildings as we start to introduce people back in?
Thank you, Katie. Thank you to you. Thanks to Matt and Chris for putting this on. This is a very timely topic. It seems that my days are right now talking about nothing but COVID-19 and what it's going to be like. We spent 2 weeks trying to shut down a company, and we've spent a couple of weeks trying to run a company, and now we're trying to figure out how to restart a company. And it's got all kinds of challenges, but there's been just an incredible amount of cooperation, I think, across many different platforms. The SVO, obviously, other high-tech companies. I'm on industry forum calls on a regular basis with my peers, and we're all trying to figure this out. But to your question, I'll just answer that, and we'll get into other topics later. I think you're going to see a scaling back of amenities at companies, and this is not just Oracle, but this is what I've heard from my peers. So the traditional lunch line with salad bars and sandwich bars, that's not going to be there when you come back, at least initially. Food, if it is available, will be in a boxed lunch format. It'll be a cashless transaction. You may have the opportunity to order it ahead of time. We're still trying to figure out if we do things like offer refrigerators for people to store food in. Other amenities such as employee shuttles, what I'm hearing from my peers is those may go away, and they probably will go away, especially initially. I know that I've heard that some of the large companies that provide massive transportation programs just aren't comfortable restarting those programs right now when we go back. So what will that mean? We may have more traffic than we thought we did when we come back, just because those vans aren't out there. Many of us rely on third-party vendors to provide us on-site amenities such as car washing and dry cleaning. We're going to strictly limit the amount of people that come to our campuses. So many of those things won't be there. Now that may be an impact to our employees, but I think it will actually be a boon to our local businesses, where people will now turn to the local businesses for some of the support that they were getting in their campuses. Fitness facilities are another one that we just don't feel that we can maintain some of the social distancing requirements and the cleanliness requirements that are going to be necessary going forward and operate those things safely. So those will go away. There are probably others that I'm not thinking about right now, but it'll be a different workplace for people. I think our employees, though, as they come back, we may not see as many employees as we had anticipated. As we had opened up in our offices in other parts of the world, specifically China, we had a much lower return to office rate than we had anticipated. 10 to 30% was what we've been seeing. So while we anticipate some big changes to what the workplace is going to look like, I think the number of employees that are going to be impacted is much different than what we had anticipated. So with that, I'll pause. I know there's other questions, but I'll let you go forward, Katie. Thank you.
Great, thank you. I think that your answer really helped kind of cast the tone for, you know, what this new normal will look like for us. So I appreciate it, Mike. Tracy, I have a question for you related to safety measures. So especially for companies where we have people leasing space within a multi-tenant office building, what safety measures do you imagine companies will want to see in those common areas and lobbies, common restrooms, elevators, things like that?
Oh, Katie, that's a big question. Noel's been hosting corporate real estate roundtables for, it seems like at least 6 weeks now. And some of the input we're getting from across the globe has to do with those, what we refer to in those social areas, those pinch points, which are the lobbies of buildings, and how they can coordinate with their property management teams to kind of sequence people back into the office place. And we start broaching all sorts of different issues about HIPAA policies, about the notion of temperature checking, the notion of an elevator cab. Is it safe for 1 or 2 people to transit up an elevator cab into a building? And it's different between an urban and a suburban model. You know, where a suburban model, somebody goes from their home to their car to the parking lot to the building, but there's still that pinch point of the lobby, the elevator cab, those types of things. Obviously, in an urban setting, mass transit comes into play. Mike mentioned even with the transit pools and the van pools and the buses, that comes into play. So a lot of companies right now are focused right on that. You know, the final mile, we like to refer to it as, is how is that last point of contact happening between a building's entrance and how they get into it. So temperature checks may become the norm in some instances. Some companies and some buildings are providing PPE on a either reusable or disposable fashion. I was just on a roundtable call this morning with a few companies from the Bay Area, but companies from around North America specifically. And some of the companies are providing those on a basis. And I think to Mike's point, the one thing we're realizing is the return is going to be, and I think Governor Newsom even spoke to this, it's not going to be a light switch that comes on. It's going to be a toggle. It's going to be a back and forth. So whatever the percentage that an organization is going to bring their teams back, it's going to be sequenced, and that return is going to be sequenced. So the impact, while it's going to be dramatic, I think it's going to be a manageable sequencing of events that bring people back into buildings as we move forward.
Great. I have a question for both of you, and feel free to jump in, whoever wants to answer it first. I'm curious how you see companies using technology to determine kind of which areas of the building are pinch points, like what you've described, Tracy, you know, where we have high traffic, and do we imagine that use of any of these technologies would influence decisions or policies on reoccupancy?
Well, it's interesting because, let's go back a couple months, and while occupancy monitoring may have been more focused on utilization of spaces and how do we maximize utilization, now those same occupancy or detection devices are going to be used to think about density. It's like, are we getting a little bit too close? Are we having too many people in certain pinch points? Those types of things. So some of the same technology, but just capturing the same data, but that data be interpreted a little bit differently. I know we work with a company called Density that's based out of the San Francisco, the Bay Area, and their monitoring technology historically was to just, once again, track utilization. Are we getting good utilization out of our real estate? Now, all of a sudden, it's being used to make sure that we're not getting too crowded in our real estate.
Interesting. Let's shift our focus into workplace planning a little bit.
Can I comment on, or Katie, I want to comment on Tracy's about density, because we found some of our existing tools are going to help us understand density and actually allow us to direct resources as necessary. Some of the new lighting control systems that are being installed, some of the stuff that's being mandated by Title 24, give you very accurate information of when people are in spaces. And if you manipulate it correctly, you can tell how many people you've had in a certain space at a certain point in time. So it'll help you understand where your pinch points are, but it'll also allow you to deploy resources to do deep cleaning if you need to, if you find you have areas where you have a lot of people. And conversely, you can find out areas that you don't have people and don't necessarily be clean. So we never intended this technology to be used for this, but we think that it's really going to help us as we come out of this.
That's great. That's really interesting. Kind of the repurposing of these technologies and also the concepts of density for to kind of satisfy the opposite need. It's Silicon Valley innovation at its finest. You know, you mentioned the deep cleaning, Mike, and I think that's one thing that if people have had their offices closed, you know, at some point we're going to want to start the process of potentially cleaning or procuring materials, making sure that we're ready to operate. Have you guys been talking at all about lead times for different activities and when to try to start things in advance of reopening your doors?
From a procurement perspective, we started weeks ago, honestly, on procuring hand sanitizers and wipes and face masks because the supply chain is pretty bare right now. Fortunately, we got ahead of the curve and a lot of that stuff is coming out. But we anticipate it could take us, you know, up to a month necessarily to get space ready when you take into account getting the necessarily signage designed, ordered, installed. So we can't wait. I think many of us in California are looking at what Governor Newsom said yesterday of nothing before June 1st in targeting our restart dates for that. It may be earlier than that, it may be later than that. It will be definitely fewer people than we anticipated, but we want to be ready when that happens. We've written a come back to work playbook that will be used globally for our company. There are many of those type playbooks out there published by some of the large real estate service providers such as Cushman & Wakefield, JLL, CBRE. Don't want to make sure I'm sure I missed one. They're probably
cover them all, Mike. You're good.
So getting started early really is something that especially the large companies and everyone I've talked to has been doing the same thing.
Yeah.
I think, Katie, that's one of the things that's seen a shift. If we look at the course of the conversations over the last month or month plus, and exactly to Mike's point, you know, if June 1st is your timeline, you know, the time to act has already passed. I mean, if you're thinking, you know, signage, physical changes to your workplace, procedures and protocols that need to be put in place, the communication plans that need to be put out there, those things have to be started now. I mean, I'm even looking for, you know, and from a perspective, if there's things that need to be ordered, let's say from a furniture standpoint, there's a 4 to 6 week lead time. So what are those considerations you can make now to make sure that when you're ready to open up your doors for business, regardless of the size of the employee base returning, that you're prepared? And I think that's kind of a shift in the message that has happened over the last 2 weeks from the people we've been speaking to.
Can we talk more, Tracy, about the reconfiguring of workplaces? You know, regarding especially high density and unassigned seating workspaces. Do you have any ideas you can share about safeguards that we would be considering putting in place to make sure employees are coming back to a safe and comfortable workplace?
we do. And if you don't mind, Katie, maybe I'll share some items I have on my screen.
Great.
Which, if you're seeing the considerations for returning to a healthy workplace, is that what I'm hoping you're seeing, Katie? Is that correct?
I am seeing what that might be under a flyer.
Okay, got it.
What are you seeing, Mike?
There we go.
Now I'm seeing Tracy.
There we go. There we go.
Perfect.
All right. So we've been spending a lot of time with our research group as well as our strategy group about what organizations really need to consider. And I think Mike touched on this. At the first wave, and this is a very common metaphor that some of those that are surfers in the crowd will appreciate that metaphor. The first wave will be a much smaller population returning. So the notion of staggered seating or A and B teams, and we experienced this from conversations we had with companies in Asia, that they were coming back and they were either staggering the week or they were staggering the team. So sometimes they're color coded, they're red and blue, or sometimes they're A and B. And for those that are in more high density benching situations, that there's actually visual cues. Mike mentioned about signage. I think signage is going to be critically important. Even team spaces, the notion of shared spaces, really reducing the amount of seats in those spaces roughly by 50%. And then obviously making sure that technology, as all of us have become fluent in whether it's Skype, Zoom, GoToMeeting, or whatever it is, that there's kind of a seamless connection for employees that cannot be in the workplace right at the moment. There's also the whole notion about, how can you start staggering some things, and how can you start, introducing vertical elements in your workplace. So whether it's the number of people in meeting spaces, whether it's vertical elements that offer some degree of separation. But we also like to take a notion and put this in the context. It is about employee safety and it's about well-being. And when we come through this is about really creating a more comfortable and healthy workplace, not necessarily a 100% sterile workplace. So I think we have to keep our eyes on the long view here, as well as we get through this interim time frame. How do we make sure that we understand coming out of this that we still need to provide a comfortable and healthy workplace for our employees moving forward?
This is great. It's a beautiful document. I'm glad we're recording this so I can look at it later. Mike, you mentioned before about we're seeing a lower rate of return in China with your colleagues over there than you were expecting. And I was curious, is that being driven by the people themselves? Is it being driven by government restrictions? Can you share a little bit about that? And then also anything else from the experience of your colleagues in Asia that you think would be useful for this audience?
If for Beijing specifically, it was a little bit of both. Part of it was government, part of it was the employees. The challenge that many of our employees are facing in high density metropolitan areas is transportation. Places like Beijing, not a lot of people have cars, so taking public transportation, people are a little bit more reluctant to do that now. In India, it's a different story. We've had very few people come back because the government has said, thou shalt not come back. And there's consequences for people coming back. Curiously, in India, many of you may be aware of this, a laptop that you are given in your office is not allowed to be taken home. There are very strict guidelines around how electronic equipment can be moved around the country. So the government lifted some of those restrictions during this period to allow people to work from home. And for the most part, people have actually been pretty successful at working from home, but that will end. And so people will have to come back in the office. In our European employees, it's funny. It just varies all over the board. We've got some parts of Asia, of Europe, that while given guidance from our CEO not to come back, they've decided that they're going to come back anyway. And these aren't necessarily because Oracle is that much of a rogue population. It's a lot of these things are cultural. There are parts of the world where your worth as an employee is determined about how often you are in the office. So there are parts of Africa where people are concerned about working from home because they feel they will devalue their worth to a company. So that's just kind of these things are fascinating to me, how while we are all sharing in this common experiences, cultures influence how people react to them.
Absolutely. Tracy, do you have any kind of lessons learned from your colleagues or your customers in China that you might think that we could benefit from that are different than what Mike has already shared?
We heard pretty much the same. The fact that while some of the businesses are opening up, they are requiring masks, and the rate of return, is just very low at the moment. They are obviously, monitoring the same thing, elevator transit, so 1 to 2 people per elevator cab, depending on the spacing of the elevator cab, those types of things. But for many, as Mike pointed out, it's how do you get, to the office, that whole transit issue becomes key. So the rate of return right now, or I guess this was about a week ago, was still relatively low. Obviously these things are changing very dramatically at the moment. I can switch, for example, we have 2 factories in Italy. Our one factory reopened this week, and the next one is scheduled to open the following week. So they're obviously taking safety protocols, social distancing. It's a manufacturing facility with offices as well. So, I mean, our approach from a Knoll perspective is making sure our employees are safe and healthy, and we're creating the right environment for that. So there's a whole notion of wayfinding and visual cues and hand washing stations and masking and all, PPE and that type of thing. But also we're following local jurisdictions as far as when we're allowed to open such facilities as well.
Sure. Okay. When you were talking a little bit about kind of working in the workplace before, Tracy, you mentioned that people are going to need to become more proficient with technology and doing like what we're doing now with this Zoom meeting. And that is one thing that's been happening over the last several weeks, is lots of people are learning how to be more effective working from home. At the same time, we're also seeing that these distance restrictions that we're going to have to employ at these working environments will kind of potentially diminish the value of actually going to those places. And so I'm curious about your thoughts on, do you think that this experience is really going to permanently change the mix of people that will come into work and how often? Is that coming up in your roundtables, or any thoughts you can personally share?
It is, and it's typical with everything. Full disclaimer, number one, I'm not an infectious disease expert, so I want to make sure we put that on the table. And number two, there are no absolute right answers in any of this. And we were on a call with a client just last Friday, who was really at that moment when said, all right, we need to start planning to return our people to the office. Let's go through what are the options we can do, we can implement, we can put in place. And their concern was making just making that absolutely right decision. And we had to assure them there's guidelines here, and we're going to be within those guidelines, and whatever you do is going to be better than what they left. So that's number one. Number two, as we look at this whole notion of social distancing, whether there's a role of technology. For example, in China, we had an example of, let's say it was a team, I think it was a team of 8 or 10. While they all couldn't fit in one room, they were seated in adjacent rooms and then connecting through technology like this. Same team, separate spaces. So as we look at this kind of coming out of here, obviously there's going to be some distancing that comes in, some shielding that comes in, but I think we're also taking an approach as saying let's make sure that it's thoughtful, it's well-meaning, meaning what those solutions are, and it's also has a sense of adaptability as, once again, on the bright side of the things, that it's still a workplace people are going to be attracted to. But getting to your question about who's coming in, there's a bit of a interesting pendulum shift. Call this morning, it was like someone mentioned, people may be coming into the office initially for a sense of quiet and focus because they have their dogs, their cats, their children, all the kind of distractions that are going around the home. While the other school of thought is it's this reshifting the office as a strategic collaborative place in a little different model. And while some of the task work you would actually do at home. So the home becomes more of the focus area, and then the office becomes more the strategic area. We'll see how that plays out. And I'm sure from a cultural standpoint, it will vary from company to company.
Yeah, that makes sense. Right now, my home is not a focus area. I'm just going to put it out there.
Put it out there.
Mike, have you guys been talking at all about how you expect your workforce, home versus working from work mix to change, and in what way?
Yeah, we've talked about it. We don't have any answers. We don't really know what people want. I liked what Tracy said about the home may be your task-oriented location and your office maybe where you do your strategic work. I think that's a good way to look at it. The concept that Tracy put forth about the ability to work from home effectively, not necessarily because you don't have the technology tools, but you don't have the other elements you need to work, a quiet space, lack of distractions, the refrigerator right across the way here. Those are things that I think are going to impact people more than anything. Curiously, I've heard some studies talk about how the millennials are having more of a challenge accepting this working from home than other generational groups, which comes surprising to me because generally the millennials are able to use technology very, very well. But I think they're also at that point in their lives where they may be in home environments that are not as conducive to concentration and things like that. So we are planning to re-examine our workspace and see what we want to do going forward. We're in the process at many of our locations around the world with updating our workplace to what we thought was the new modern workplace with more open and collaborative areas, more benching. Tracy's very aware of how companies do this. But that is not necessarily going to be the way people want to work. And the other thing that we're investigating is we're not going to have as many people in the office. So do we need as much space as we had before, which makes our real estate partners really nervous, which could have many downstream effects to all of us if the commercial real estate market is significantly affected. So we paused a lot of those remodels that I talked about until we have a chance to look at what's going to be what people want. We are very careful as we make this pause and start pondering that next workplace is, we don't want to build a workplace that we need and is effective for the next 90 days, 6 months, 12 months, because we're not quite sure what will happen when that ends. Will there be a migration back into the office or not? We all right now are saying with short-sightedness that, oh, this is going to be a new workplace going forward. We can't go back to what we had before. I don't know if I'm 100% convinced of that yet. So I think all of us are going to tread lightly, and folks like Tracy are going to help us figure this stuff out because they probably have a lot better data than what we have individually as companies.
Yeah. Yeah, it is interesting. I think a lot of us are really focused on what is it going to be like when we first go back in, but this whole thing has been a journey and it's been changing the whole time. And I feel like the rules are different every day when I wake up, and we'll probably see that continue even after we bring people back in and start to resume operation. And a lot of that will be driven as much by them as by anything else. And so I wanted to talk a little bit about the workforce, and and I'm really interested to hear both of your perspectives on this, on, in many ways, this has been a great trauma for a lot of the people who will be coming back to work. And, a lot of really nice things have happened for some folks as well. More time at home, more time with family. But, living through something like this is also very difficult. How do you expect the emotional well-being of employees who return to impact the workplace?
I'll pick up on that. I think there's a couple things. I'm going to go off on maybe a couple tangents, Katie. But I'll weave it back together. So, I think there's been this kind of lure of seclusion that's gone on, meaning that some people, as they've sheltered in place, they found their different secluded moments. For some, maybe they actually had another, like a more rural setting, or something that they could kind of go to for that seclusion. For others, it would simply mean, do I work outside one day versus I work, in my kitchen another day? I mean, there's different levels of that notion, but there's this lure of seclusion and how that may be coming back into the workplace itself. I think there's also this notion, that's why we're really focused on what can we think about regarding comfort and sanctuary and refuge and those types of spaces getting planned and implemented into a corporate portfolio, versus the early days of this. Quite frankly, it was very sterile. The notion of we almost, are creating mini ICUs around desks, to just keep everybody safe. So I think the thinking has really evolved quickly. We're, excited about things like, more biophilia. I mean, you're putting plants in there, in the notion of if you have a little bit of physical distancing, coupled with the fact that you may have a lower population. I think to Mike's point, to maybe make the real estate folks, hearts slow down a little bit. We're seeing that the same amount of real estate that's utilized differently is what people are talking about, versus any type of contraction from a real estate portfolio standpoint. So I think this notion of well-being and biophilia and a healthy workplace are things that help counter exactly what you talk about, which is trauma. And I think we've also witnessed, post, I'm going to cite an example. One of our designers early on, I mean, this is post World War II. Jens Rism came up with a chair that was made out of parachute straps that were salvaged after the World War II. And I think so I think we're at this cusp of innovation as well. I think a lot of people have been thinking about a lot of different things and how can that improve their business, how it can improve their employees' well-being as we move forward with hopefully a new era of innovation moving forward.
Great. How about
Katie,
you, Mike? Any thoughts?
Katie, it looks like we lost Mike. He fell off the call. I think he had a glitch with his internet.
Oh.
He's trying to get back on right now.
Okay. We'll ask him about that when he comes back on. So it's actually getting close to the time that we're going to look for questions from the audience. So I'll encourage people to start chatting things in if they have questions for either of our panelists, especially questions for Tracy soon, while we wait for Mike to come back on.
And Mike soon. And Katie, if you want, I mean, I'm happy to share, I've got a document up that people can, once again, download from our website that is really just talks about things that they could look at as they move forward in considering for a healthy workplace. Obviously, vertical screenings coming into play, and we have a lot of benching in the Bay Area. How can you, and once again, this is a perception of safety that you're putting in place for your employees as they return. Once again, not an infectious disease expert. So, there's the staggered seating that we mentioned, is there an opportunity to offer more storage? Once again, just whether you have a spine-based system, is there a way to do surrounds around that? Height adjustable tables, of course, are huge from a ergonomic standpoint. If they're freestanding, how can they really be configured in a way that offers some degree of social distancing into the model? And those independent desks that we see sometimes just plugged into the floors really have the same need and the same requirements. So we're seeing a lot, I think, from an innovation standpoint that's coming into play. I think one of the things that's been fascinating for those that are still in a panel-based scenario, that becomes a very flexible solution moving forward, whether it's through glass add-ups or stackable screens that can be added to models moving forward. So I think there's a lot of options out there at the moment. So
That looks great. So we can go to the Knoll website to find that information?
Yeah, if you go to knoll.com, we have a feature about working remotely and the healthy workplace. And there's a whole, we have this, we have one of the things that this audience might find beneficial, just a checklist, considerations for returning to a healthy workplace, whether it's change management, coaching, work from home and flex work strategies, how you reach, the outreach to your customers, those types of things. But it covers a lot of things, and I'm sure all of you have your own checklist, but if you want to maybe compare it to one we've collected from a myriad of sources, happy to share that. Yeah, so that's just at knoll.com. So
that's great.
Mike, I see you're back, Mike.
Welcome back, Mike.
Can you hear me?
We can.
Oh, okay, good.
Katie, this is Matt. I got a couple questions out of the chat box, if you don't mind me jumping in.
Mm-hmm.
No, go ahead. Actually, before we do that, do you mind, I just wanted to give Mike a chance to answer the emotional well-being question if he had anything before he dropped off. We kind of lost him right in the middle of that discussion.
I don't have anything specific. We haven't really looked at it. Just anecdotally, what I've observed is as I watch my team, I meet with my team almost every day. Their emotions are up and down. We've had several brown bags with larger groups, and people are, it's a roller coaster of emotions, and some people have good days and bad days. I can tell you that by the end of the work week, and most of my people are working full days during the work week now, they're exhausted in a different type of way than I think they were during prior to COVID-19. So we're just trying to be sensitive and kind to everybody, and I think that seems to be a common thread that everybody is exhibiting right now. So I think you have to understand that what we're going through is a trauma, and you have to make sure that you're treating people as going through trauma, and it'll be, time will tell how we all react to this, I think.
Yeah, thank you for that. So yeah, Matt, if you can curate some questions for us from the group chat, that would be amazing.
Yeah, happy to do it, Katie. This is kind of a two-part question, and first is, and it's probably for Tracy and Mike can add in. The first question was, what evidence exists to validate that the remodeling recommendations will be effective in the prevention of COVID-19 spread? And the follow-on part of that is, when planning for these new design, what are certain measurement requirements you're trying to achieve on cube height, standing desks, sitting desks? What type of materials do you see people using in those workstations?
I would say from an actual evidence, once again, my disclaimer early on, and we're not infectious disease experts, but what we're trying to do is follow good science. And there's actually some good publications from OSHA and the CDC that start indicating, certain heights. It's, for example, screening above the desk anywhere from 21 to 24 inches from above the work surface. Is it going to prevent the virus from, transmitting to other places? Probably not. But is it going to give us one level of barrier to hopefully offset that? Yes. Is it going to be a fail-safe? No. I would say, once again, it's creating a perception of safety and also putting in place some degree of containment that, at least on an individual basis, people feel that if a sneeze occurs, and I know we're going into allergy season as well, so there's all this kind of trauma around the notion of what a sneeze means anymore, that it helps contain some of that. As I said, there is no exact answer here. There are, can we go up? Obviously, higher is better. One of the things we've been talking to is building management. It's also the volume of air. If we have air coming down from the ceiling, and the volume of air and the percentage of fresh air. And if something does happen in that, the virus can be blown down away from mucous membranes, such as your eyes and your nose, obviously that becomes a better thing. So it's not kind of a one single solution. It's kind of holistically how we're looking at the workplace to help mitigate transmission.
Okay. For employees coming back, there's questions around temperature checks and temperature checking employees. Who do you think will be qualified to do that? Do you think companies are going to be doing it? How do you handle the high flow? Do you see people using thermal cameras, or is it, the security staff? Is it an employee of the company, or is it a contractor? Or how do you guys see that working?
Mike, do you want to touch that one? You're on mute, Mike.
Yeah.
There you go.
Okay. We're not going to do temperature scanning unless it's mandated. We don't feel qualified to do it. Now, some parts of the world, it is being mandated, specifically in China, and we've hired a third-party company to do that. The question of flow, I think, is one of the reasons we don't want to do it. We just don't know if we would have the capacity to do it. We've looked at plans of changing some of our campus environments so that there's a single point of entry, and those temperature checks take place when you come in through your car, but it's just not practical right now. And unless we're mandated to do it, I don't think we plan to do it.
Yeah. We have heard that, if you have a nurse, like a nurse on staff and their team is qualified to do it. We also heard of a kiosk. I think a company called Wello that does this, like Station X, that comes in and does a thermal scan, and you get a little badge that gets printed out and says, I'm Wello today, within the whatever the temperature range is that the company sets for entry. It's like I said, there's no 100% right answer that every company is doing. It's all going to be different.
Well, we feel like temperature checking is a false sense of security. As many of you know, you can have COVID and be very contagious and be completely asymptomatic. So for the return that we would get, we've decided, at least right now, not to pursue it unless mandated.
What about face masks? We had a couple questions about face masks, and our employers, is it going to be their responsibility to provide face masks, and are they going to do it? And, or is it just going to be in pinch points or in social gatherings? How do you see that working, Mike?
We're going to provide face masks for our employees. We're not going with paper disposables. We're going to go with cloth face masks and ask people to launder them themselves. Part of the reason we're going that way is we just couldn't get paper masks in the volume that we need them. So we are buying face masks for everybody. If you need a face mask, we'll give it to you. The hope is that people will use that as a very scarce resource and not take multiple face masks. Our hope is, though, we're not going to have that many people in the office, so it may not be a big deal. We're going to discourage visitors. Very few visitors will be allowed in, so we're not going to have to worry about masking them up. Many of our contract companies that come in and provide support for us, such as janitorial, food service, and general contractors, we're expecting that their companies will provide any PPE that's required for them.
There's some great comments occurring in the chat room. If you guys want to take a look at that, and some nice recommendations. I did post early on the resource, a link to the resource page to the Cushman Wakefield COVID-19 resource page. They've done a really nice job there. Also an SVO member, so I don't mind promoting them. And then some of our other members are making comments as it relates to their industry as well in the chat box. So I'd encourage you to take a look at that. I think you touched about this early on, Mike, about food services. That's going to be completely not happening on site at many of these corporate campuses, or it's going to look completely different.
Yeah, initially that's our plan, is to have no food service. But I think we will relax that as we figure out number one, how many people are going to come back, and number two, if we can completely provide food to the food we're not as concerned about, it's how we will distribute the food. So even a lot of the break room amenities that many companies are used to providing, I know that Google's talking about eliminating those partially as well. So people will have to learn to make a sandwich.
Yeah, we've been hearing the same. We had a company, a Swiss company, that was closing their food service altogether, and they actually are a manufacturer of food product. But then also, just recently this morning, a company in Ohio that just is switching completely to grab and go. So just a changing. One of the things that's changing in the interim. So.
There was another question as it related. People were wondering, Tracy, if you guys and all the furniture folks are slammed. Or are you still waiting for people like Mike Bangs to make a decision?
Yeah, we are. And I think it's been a heroic time. I think some of the thinking, some of the late nights that I think all of us are witnessing, the work from home, and how do you connect teams either from a strategic standpoint, or then obviously factor that into a product development and product application, and then obviously keeping in close contact with our dealer distribution folks to make sure that it can actually then happen in the field. I mean, the one thing I've always been talking to, for example, like one of our primary dealers in San Jose is KBM Hogue, is like, okay, what about the installation teams? Are they going to be safe? Are the procedures and protocols in place? So these solutions, as we're able to ship them, can they put them in place? And I think the one thing that's been valuable for Knoll is the fact that we've been able to keep our facilities open. We had a facility in Pennsylvania that did close for one day on governor order. We were able to get a waiver because we do provide solutions for healthcare and key critical government agencies. And the manufacturing's also pivoted. We're making face masks from our textile division as well, 2-ply face masks. So it's been some late nights, Matt.
You're not going to complain, are you?
No, we're not. I mean, it's, as I said, these things have an amazing ability to stimulate innovation. So we're looking at it as with all the bad news that's coming out, we're trying to keep focused on what we can do to just move this forward in a more humane way. And I think that especially comes into play when we think about the workplace moving forward.
I just want to jump in. There's been a couple of interesting things shared on the chat. One related to food service. So, we talked a lot about food service shutting down. It can be an important risk management measure to provide food so people aren't going just to restaurants and picking it up. And so there are a number of folks that have chimed in with availability of box lunches and things that could be brought to campuses. And so I just wanted to encourage folks, if they're interested in that, to take a look at the chat. It's important to support our restaurants if we can. And then also, it looks like.
Katie, can I pick up on that real quick?
Sure.
Because I think we learn. I think there's some best practices out there. I think the small bodega. I live in San Francisco. The small bodegas, the grocery stores, all those types of things. They've put in some best practices early on that I think we can look to them and hats off to them. I mean, because the whole notion of the food production and supply chain that is, quite frankly, keeping us fed is phenomenal. And I think they've done a great job. And there's a lot of lessons we can take from that, as well as those restaurants. I think one of the folks in the chat room talking about the local restaurants, they've also, the ones that have really, thought about this and innovated. I was at a place here in San Francisco that they had a cashless, but you still had to sign. They had a tin for clean pens and a tin for dirty pens, so they've really thought through this. I think whatever we can do to keep our restaurants and cafes and those places that make the Bay Area so special up and running, we should do whatever we can do.
That's great. And then the other thing is, it looks like there's some loosening on restrictions for construction coming. So while we were all talking, some news came out. So yeah, that's great news.
There's a press conference happening in 3 minutes with the county health officer, and we were expecting some announcements today, and looks like the Merck has broke the news a little early here, where they're going to loosen restrictions around all construction, from what I can gather. If you want to go play golf, you can do that. You want to go play tennis, and then landscaping. It's a start. We're hoping for more, and we're going to push for more. What I do want to encourage people is that if they are looking to open up their business, bless you, Corey, if people are opening up their business and want to open up their business, they really need to be putting these protocols in place, and thinking about that and putting it into a white paper and putting it into a document. And feel free to share it with me and the SVO so we can use that as a piece of advocacy to go to the county and the county health officer to help open up your industry sooner or later. If we can demonstrate that these companies and industries can operate safely and push on them, then maybe we can get them open sooner than later. Any closing comments, Tracy, Katie, or Mike?
I just want to say thanks. I had a great time talking with you guys, and I feel like I learned a lot, and I think it was wonderful to share your knowledge with this very large audience. So appreciate everybody tuning in, and appreciate you guys sharing your thoughts.
Thank you, Katie. And I hope everyone's staying healthy, and we look forward to hopefully seeing some or all of you in your offices soon. So.
Great, thanks. Thanks, Mike. Tracy, really appreciate you guys participating. Great information. Christian, thank you for helping pull us together with IFMA. It's a great partnership, and we want to keep working with you guys. Want to let you guys know that we have more events, webinars coming up soon. We're promoting these activities to our members and to our non-members. If you are not a member of the SVO, check us out. We're providing a lot of information, tools, resources, and networking to help you survive and thrive in the new. We have another webinar coming up this Thursday, actually tomorrow. We'll hear from Rosalind Huey. She's the Director of Planning, Building, and Code Enforcement in the City of San Jose. So she will share the latest on construction and building permitting services that are still available under the county order. And obviously she'll have more to talk about as the SIP is lifted in the construction industry. You can find out more information about that on the SVO website, and continue to monitor our website for more updates and information. Tracy and Mike, Katie, we really appreciate you being with us today. You guys did a great job, great overview. This will be recorded. It's going to be online pretty soon, later today. So go check that out, and really appreciate everybody being with us. Stay safe, stay healthy, and go out and have a prosperous day. Thanks so much.
Bye, thank you.
Thanks, everyone.
Thank you.